ADHD, or attention deficit/hyperactivity disorder, is a neurodevelopmental condition. It affects both children and adults. People with ADHD often struggle with attention, focus, and impulse control. They might also be hyperactive. This can make it hard to succeed in school, work, and relationships. Imagine trying to focus on a conversation while a dozen butterflies flutter around your head. That's what it can feel like for someone with ADHD. Thoughts jump around, distractions are everywhere, and sitting still can feel impossible. This can lead to frustration, low self-esteem, and difficulty reaching one's full potential. It's important to remember that ADHD is not a sign of laziness or lack of intelligence. It's a real medical condition that affects brain function. The good news is that with proper diagnosis, treatment, and support, individuals with ADHD can thrive and live fulfilling lives. It's all about understanding their unique challenges and finding strategies that work for them. ADHD often shows up differently in children and adults. Children might be overly energetic, have trouble staying seated, and interrupt others constantly. Adults, on the other hand, may struggle with organization, time management, and controlling their emotions. Let's break down the common symptoms into two categories: inattention and hyperactivity-impulsivity. Inattention includes difficulty focusing, getting easily distracted, making careless mistakes, and struggling to follow instructions. Hyperactivity-impulsivity manifests as restlessness, excessive talking, interrupting others, and acting without thinking. While these symptoms are common, it's crucial to remember that ADHD is not a one-size-fits-all diagnosis. Some individuals may primarily experience inattentiveness, while others struggle more with hyperactivity-impulsivity. Additionally, the severity of symptoms can vary greatly from person to person. It's also important to note that some of these symptoms can be normal behaviors in children, especially younger ones. However, when these behaviors are persistent, excessive, and interfere with daily life, it's essential to seek professional evaluation. A qualified healthcare provider can determine if ADHD is the underlying cause. Diagnosing ADHD is a multi-step process that involves gathering information from various sources. There is no single test to diagnose ADHD. Instead, healthcare professionals use a combination of evaluations, interviews, and observations. Parents, teachers, or the individual themselves may fill out questionnaires about the person's behavior. A physical exam can rule out other medical conditions, and a clinical interview helps the healthcare professional understand the individual's specific experiences and challenges. In children, the diagnostic process often involves observing their behavior in different settings, such as at school and at home. This helps determine if the symptoms are present in various environments or limited to specific situations. Diagnosing ADHD in adults can be more complex, as symptoms can overlap with other conditions like anxiety or depression. It's essential to provide a comprehensive history to the healthcare professional, including childhood experiences and any family history of ADHD. Remember, getting a proper diagnosis is crucial for receiving appropriate treatment and support. If you suspect you or your child might have ADHD, don't hesitate to reach out to a qualified healthcare professional for a comprehensive evaluation. Managing ADHD is a journey, not a destination. It's about finding the right combination of strategies that work for the individual. This might include behavioral therapy, educational support, lifestyle modifications, and medication. Behavioral therapy, particularly cognitive behavioral therapy, CBT, can be highly effective for both children and adults with ADHD. CBT helps individuals identify and change negative thought patterns and develop coping mechanisms for managing their symptoms. Creating structure and routine is crucial for individuals with ADHD. Setting regular schedules for meals, sleep, and homework can provide a sense of predictability and stability. Breaking down large tasks into smaller, more manageable steps can also make them less overwhelming. Moreover, accommodations in school or the workplace can significantly improve an individual's ability to succeed. These accommodations might include extra time on tests, preferential seating, or access to assistive technology. Remember, managing ADHD is a team effort. It requires collaboration between the individual, their family, healthcare providers, and educators or employers. Open communication, ongoing support, and a willingness to adjust strategies are key to successful management. MD Searchlight. Be your own advocate.